This is a presentation on the poster Fahr's disease. Where are we at with this Parkinsonism? So thank you to all the contributors to this poster. Earlier in 2026, Fahr Beyond conducted a international patient experience survey for people living with Fahr's disease, also known as primary familial brain calcification. Now, this is the first large scale survey of the patient population that's been undertaken, certainly of our knowledge. And here we can see that there were a number of different genetic variants reported of those who were taking part. So that's really important to bear in mind. Fahr's disease is a neurodegenerative genetic condition, usually with calcification within the basal ganglia, um, frontal cortex, cerebellum, and it's characterized by a range of potential symptoms, including Parkinson, um, tremor, dystonia, loss of memory, urinary symptoms, motility issues, cognitive dysfunction, um, psychiatric conditions as well. So, we wanted to identify a whole range of different potential symptoms linked to the different genetic causes. So, identifying those lived experiences within different genetic variations, variation depending upon geographic location, particularly within the diagnosis and management of the condition. Trying to understand how the disease is most commonly managed, to understand what's most effective, potentially, and understand some of the needs of people living with FARS. What else do they they need? What is not currently being provided? So we found that quite a significant number of participants didn't know their genetic variation. That might be because no genetic testing's taken place, or possibly uh, because we don't know the genetic variation, although we're aware of 8 different genes that causes the condition. There's certainly others that we're yet to discover that do also cause FARS, and particularly those that are autosomal regressive genetic variation rather than autosomal dominant um, genetic variations. So we can see that by and large, medical imaging is one of the most important parts or most commonly used methods for diagnosis of FARS. Genetic testing in around 40% of people has taken place. So again, questions as to where that's happening. This tends to be Europe rather than anywhere else in the world, based when we dig deeper into the data. Cognitive tests and other forms of tests are also used. So we can see that there are a number of condition kind of symptoms that vary depending whereabouts in the world. This is a heat map and the type of symptom that is occurring. And by and large, the most common symptoms are anxiety, depression, sense of loneliness. So, broadly, psychiatric symptoms seem to be the most common. Mm. And then followed by more physiological factors such as tremor, difficulty in moving. I think here what's important, there's certainly a link when we think about loneliness. Loneliness, particularly between the ages of 30 to 41 and then 60 plus, appear to be most significant. And jumping over here to some of the main concerns of patients have been around lack of awareness, thinking about future, impact on families, communication and support needs, and being able to tell people about what the disease is and implications moving forwards. And this also is not restricted just to general public, but also lack of awareness among the healthcare professional community. So, not unsurprisingly, some of the support needs requested by patients linked to that sense of dialogue. So, a patient helpline, sharing of patient experience videos, and being able to get one's story out there. So, patients want to share their stories about what it's been like to live with the condition. So, whilst Far Beyond is making progress, there's certainly still more progress to be made. Um, Surprisingly for Far Beyond, I think, and the uh, healthcare community, based upon this survey, over 87% of patients are symptomatic. So that means that there's a large community there that do need support with managing of symptoms. And we need to advocate more for genetic diagnosis, genetic testing. We need to think around mental well-being and what we can do to better provide pathways to coordinated care that involves mental health practitioners and counseling services, but then also utilizing the community to provide more opportunities for dialogue to try and end that sense of loneliness, better connectedness, albeit online. We do have to remember this is a rare condition, and so sometimes in-person meetings, groups are not possible, but enabling a vibrant online digital community is just as important. And thinking particularly around early onset, this 30 to 41 age group, which would be classed as early onset if we were thinking specifically about Parkinson's. So we need to think about how we engage all of our community effectively. So we will provide more information in the form of a report, which will be available through our website. We just want to say a thank you to everybody who supported us in being able to provide this poster and the, importantly, the International Patient Experience Survey